Hi, I'm Raven Knickerbocker. I'm the radiographer, and I'll be taking your son's CT scans today.
I'm Miss Roth, and this is Mr. Roth.
Okay, and what's his name and date of birth?
Jacoby Roth, 12/4/2013.
And what's he here for today?
Well, he was jumping on the bed, and he fell off, and now he's complaining of neck pain.
Okay. All right, let's get started. We'll be doing some images of his spine that the doctor requested. You can go ahead and lay him on the bed. Is Dad staying in here?
Yes.
Okay. You can have a seat, and I'll just put the shield over you. And Mom, you can go with me, and we'll go out and get started.
Okay. Do you know how much radiation my son is receiving from this? He had a CT scan on his head previously.
I'm not sure. I can't provide you with the exact dose amount. It's not in my job description. You could ask your doctor, though.
Well, is it common for these procedures to be done on children at this age?
These types of scans are done all the time here. I've been doing this for a long time. We're going to take a couple scout images. It's one of the first images. First. There's an error message. I shouldn't have got that because it's correct.
Shut it down.
There was an error message. It went away. It's good now. There's another error. Let me look at the manual. And we're all finished here.
Okay. In court today, we have Miss Roth suing Mad River Community Hospital over CT radiation dose. Plaintiff, Mr. and Miss Roth, defendant, Raven Knickerbocker.
All right.
Okay, what's going on?
We're here today because the defendant, Raven Knickerbocker, pushed the CT scan button 151 times, which resulted in a radiation overdose to Jacoby Roth, a 2-year-old. We're here because Ms. Knickerbocker was negligent and has violated the American Registry of Radiologic Technologists Code of Ethics 4, which states, the radiologic technologist practices technology founded upon theoretic knowledge and concepts, uses equipment and accessories consistent with the purposes for which they were designed, and employs procedures and techniques appropriately. She violated this when she kept getting error messages and continued to use the equipment. Code 5 was also violated, which states, the radiologic technologist accesses situations, exercises care, discretion, and judgment, assumes responsibility for professional decisions, and acts in the best interest of the patient. When she kept using the equipment after getting error messages and being told by another technologist to shut the machine down, the patient was not being cared for in his best interest.
Ms. Roth, did you see her push the button?
Yes, I did.
Okay. What's going on over here?
I was upset because I didn't understand how there could have been an overexposure when I had taken about 6 images. I was more upset about the fact that it was believed that I would do this to a pediatric patient or any other patient for that matter. That was my main concern, that there was an injury, a potential injury created by myself.
My client, Raven Nickenbacker, did not realize that she was exposing the patient, Jacoby Roth, to so much radiation because she was receiving an error message and she did everything that the error message told her to do. Ms. Nickenbacker received her degree from HEMA Medical Institute in Albuquerque, New Mexico. She received her license in 2000 and maintained her certification with the ARRT and has additional training in mammography, fluoroscopy, forensic science, and radiation physics. When the Roth's examination occurred, Ms. Nickenbacker had performed more than 100 pediatric scans, including cervical spine exams.
Did you see the 151 images that you took?
The scout image and the first few images looked familiar as I saw them on the monitor during the study, but I had not seen 151 images in their entirety until I reviewed them with counsel. I cannot accept responsibility for something I did not do.
Then why are there 151 images and here are some of them?
The only explanation I can think of is a mechanical error, or some kind of programming error through the computer where the machine is assuming and performing an exam that I didn't ask it to do.
So you programmed the scanner yourself? Have you ever experienced a situation in which you programmed a machine in a way that it would continue to take images when the technologists did not think they would?
I have never seen anything like that happen before.
This is you, Blue. What you gotta say? This is you. What laws were broken?
Oh, Ms. Nickenbacker also violated codes 6 and 7 of the ARRT Code of Ethics, which read, the radiologic technologist acts as an agent through observation and communication to obtain pertinent information for the physician to aid in the diagnosis and treatment of the patient and recognizes that interpretation and diagnosis are outside the scope of practice for the profession. Radiologic technologist uses equipment and accessories, employs techniques and procedures, performs services in accordance with an accepted standard of practice, and demonstrates expertise in minimizing radiation exposure to the patient, self, and other members of the healthcare team. When the father, Padre Roth, began to become impatient because of how long it was taking, she should have already changed rooms, knowing that this particular exam doesn't take more than 5 minutes. Code 7 was violated because she overdosed a pediatric patient to radiation and caused a red ring to form around his head going all the way around.
Okay, my decision. You lost your license because this is the rash that is on 2-year-old Jacoby. What are we doing? Living?
All right.
Hang on first.
River pediatric CT radiation case. California hospital fined $25,000 for pediatric CT radiation dose.
She didn't let me say that last part.
That's it. You can turn it off now.
Me for the rest of my life, regardless of what I do. I wouldn't want to put anyone at risk. I went into this field to help people, not to hurt anybody.
My poor baby. He's gonna be better though. He's gonna be better. I think she got what she deserved. I mean, I don't know. We're gonna be good.
Yeah.
We're gonna be good. Oh my God. My poor son. It's okay. It's gonna be good. Everything's gonna be good.
be